IVF babies look different? It is generally thought that IVF babies look very different or behave very differently, or IVF babies are generally not considered normal, as people think that they are developed in the laboratory or due to certain technological innovations, and they may not be the same as normal babies. However, it is important to know that IVF babies are both physically and mentally very much like any other normally conceived babies. And sometimes, of course, there may be a slight difference in the characteristics, as in they may look like the grandparents or the cousins or the uncles or aunts instead of the parents themselves, but this can happen even in case of normally conceived babies as well. As far as the mental capacity is concerned, it is actually thought that IVF babies have higher IQ than normally conceived babies, which means that they are probably much smarter than normally conceived babies. So there is no need to be unusually worried about their physical or mental appearance. In fact, in a lot of cases, it is also seen that, especially in programs where we use donor gametes or even donor embryos, where it's medically necessary, of course, and it is seen that even babies born out of donor gametes also seem to resemble the parents who carry the pregnancy to term. This is because of epigenetics, and also probably because there is a very rigorous screening process that is involved when we look at donors. As in, we try to match the donor as much as possible with the commissioning parents in terms of the skin color, the color of the eyes, the hair color, so that they don't look very different from the parents. So it is probably not right, or we need not worry that the IVF babies are going to be something very different. They're considered as designer babies, but still it doesn't necessarily mean that they are any different, and the process of natural selection and the genetics and epigenetics all make sure that the IVF babies resemble the parents as much as possible. Thank you.